Hello. Okay. Good evening. It's 9 p.m. in Nigeria. Normally, I do my live streaming by 8, but I went out. By the time I got home, I need to just take some rest before coming on. How was your day? Hope you had a beautiful day. And if your day is still going in other parts of the world, I wish you all the best. This is the fashionable midwife this night, coming on this live stream to talk about prolonged labor. Prolonged labor. We all know that when a woman is pregnant, there will be a time that the baby needs to come out and she starts having labor pains, contraction, with so many things. And, there's hours that we get that for a first mom, she can spend up to 12 to 18 hours before delivery. But for a woman that has given birth before, she delivers, labor can be between 6 to 8 hours. But anything outside this is prolonged labor. And prolonged labor sometimes can also lead to obstructed labor. But that you have a prolonged labor does not mean that you cannot deliver vaginally. We can assist you as midwife to give you oxytocin injection, oxytocin drip, and to enhance your labor and see to induce the labor and to help in contracting very well and see maybe this will work. If it works, fine. If it does not work, there's no reason for you to panic. Just relax. You are with your midwife, so you don't have any problem. She's here for you to take care of you, and she will do justice to everything that concerns you. So, good evening, good evening, good evening. Let us see. Ah, let's see and wait for more people to come up to come and listen to this beautiful topic, prolonged labor. Praise the Lord, hallelujah. Lifting up, hallelujah. Praise his name, hallelujah. Praise the Lord, hallelujah. Hallelujah. Ẹ̀yin Olúwa lógo, hallelujah. Hallelujah. Ẹ̀yin Olúwa lógo, hallelujah. Welcome, Agnes Mensah. Good evening. This is the fashionable midwife. I normally come by 8 p.m., but I went out today. By the time I got home, I was so tired, so I had to take my dinner and rest before coming up by this 9 p.m. How was your day, Agnes? Hope you are fine. This is the fashionable midwife. And this night, I want to be talking about prolonged labor. From the name, you know what it means. You know, as a healthcare provider, we have stipulated time that we say between 6 hours to 8 hours, or between so hours to this hour. A woman in labor with regular intrauterine contraction without any problem supposed to deliver at this set time or within that range. Just like I explained about expected date of delivery, EDD, that if the doctor says you are going to deliver on October 10, it does not mean that you will deliver on that October 10 gogo. You can deliver 2 weeks before that October 10 or 2 weeks after uh October 10. So it's expected estimated date of delivery, that's what it means. So also this labor, a woman that has given birth before, I've said that a few minutes ago, that a woman that has been giving birth, her labor usually lasts from 6 to 8 hours. She will deliver. Not this is just a general assumption. It may differ from one woman to the other. Then if it's a first time mom, which we call primary in the hospital, that has never given birth before, her labor can take as much as 12 hours to 18 hours before she delivers. But if anything goes out of this, that is, prolonged labor. prolonged labor. And there are so many things that may be responsible for this. Nwa Ndawi, I know you are a Nupe man from your name. Good evening. How was your day? You are welcome. Please, as you are coming here, help me to like, tap on your screen and like this live streaming. Thank you as you do so. God bless you. So I said that prolonged labor means that labor is longer than usual to progress. This can happen for different reasons and it's very common in first time mom. Labor can prolong more than the usual hours, and this is very common in a first time mom. It may be a girl that just got married and she's now pregnant. She's likely to have this prolonged labor. And as I used to say it every time, that most of these cases, when you say what are the causes, sometimes we say the first thing we say is the cause is unknown, but there are predisposing factors that can cause this prolonged labor. And I'll be dealing with all this evening. And you know, this prolonged labor, we have 5 P's of prolonged labor. We have the power, we have the passageway, we have the passenger, we have the positioning, and we have the psych. 5 P's of prolonged labor. When I say the power, that is the contraction of the uterus. Is it good? Is it coming frequently? You know, even in the hospital midwives, we check the frequency of the contraction and the intensity so that we will know how the labor is progressing. When a woman is in labor in the hospital, we have our chart that we chart. Is it every 15 minutes? Is it every 10 minutes that she's having contraction? All these things will be checked and will be written down, because in nursing or medicine, data entry is very important, because this has taken a lot of midwife or nurses or doctors to court, to prison. So whatever you do for your clients, you need to write it down, because if some clients, they are very difficult. They say, she didn't look at me very well, she didn't check me. No, even vaginal examination, it's not that every hour you have to go and be poking your hands into somebody's VJ. No, it's every 4 hours that we do vaginal examination to see the progress of labor, to see how far the presenting part has descended into the birth canal. From there, as a midwife, you know maybe this labor is progressing or is not progressing. From there, you will know. And if there's any action you want to take immediately, you call your doctor, you can come and check. Then, whatever I advises from what you have told in E2, we cross-check. Then you put heads together and know the next thing to do for your clients. Is very important. Then, the passageway, that is the birth canal. I'm talking about the 5 P's of prolonged labor now. I talked about the power, that is intensity of the uterine contraction. Then the passageway where the baby is passing, that is the birth canal. Then the passenger, that is the baby. Is the baby rotating the way it's supposed to rotate? You know, when the woman is in contraction, the baby is also trying to come out. So the baby too will be maneuvering itself, through the birth canal for the baby to also come out. The baby also wants to come out and see his mom. Then the positioning. Just yesterday, I think, was it yesterday or which day, I talked about the presenting part of the baby. And I said that if it's transverse lie, I have this my baby here. I said if it's transverse lie, this is how the baby will lie horizontally across the uterus. So there's no way this kind of uh positioning can help the labor to progress. No, no, no. But if it's cephalic, most time it helps, and it's the commonest way of the baby to present during uh labor, especially when the pregnancy is about 38 to 40 weeks. The baby, if the baby is cephalic, all things being equal, that labor will progresses very well, because the head also will help in exerting pressure on the internal host, and that there will be effacement, and the cervix will dilate as at when due, and everything will be fine. Please, as you are joining, help me to tap on the screen, help me to like. You are all welcome. Adewumi, Madam Adewumi, good evening. Do you, if you are a midwife or a nurse, I can ask you to, even if you are not a midwife, experienced woman that has given birth can say one or two things. So you can join me if you request to join me. I don't mind. Nobody is an island of knowledge. And as a mom, all of us have tasted labor pains, so we can say one or two things about labor pains. I'm talking about prolonged labor. I'm a midwife. So I come here every other day, or sometimes I do come every time, to talk about different things concerning pregnancy, newborn, and so many other things. So I was talking about positioning of the baby, that it can also cause I said 5 P's of prolonged labor. I've talked about the power, the passageway, the passenger, the position, then the psych. That's the psych of the woman, because some women, they are so anxious about this labor, especially a first time mom. She must have had a lot of stories about labor pains, and she's so scared. And that alone, anything done under fear is always chaotic. So we have to tell her to calm down. We have to tell her to relax, so that everything will work out well for her. And just like I said, this prolonged labor is very common in a first time mom. First time mom is very common. Not that you can't see it in a woman that has given birth before, but there must be a reason for it. But most time we find this in this first time mom. And what are the causes? We have irregular contraction, just like I said. When the uterus is not contracting the way it's supposed to contract during labor, it could lead to prolonged labor. Uh, and the labor may be very slow, and this we can say she has prolonged labor. Then we have what we call CPD, that is cephalopelvic disproportion, when the baby's presenting part is bigger than the birth canal. Some baby, the baby may actually be presenting cephalic, just like I explained yesterday, or which day, that look at this baby, the head is down. This is the normal presentation. Most, about 90 something percent of women that comes to the labor, their baby comes through a cephalic presentation. We can also call it vertex. The head will be down like this, while the legs will be up. The legs can be well flexed. So if it's cephalic, and maybe the baby is bigger than the birth canal, this is what we call CPD, cephalopelvic disproportion. Cephalo means cephalic, pelvic, that's the pelvic of the woman. So the baby's head may be bigger, and it won't be able to pass through. So it's one of the causes. Then anxiety or fear that slows labor's progress. Just like I said, especially the first time mom, she has had a lot of stories about birth. Some did not even hear, but she's just scared because she has never done this before. And most time, anything new, we are always scared. I remember early this year, when my daughter came to Nigeria, she told me that, mommy, you've been dancing and dancing on social media. I'm not saying you should not dance. It's good, it's an exercise, and it's what you love doing. It makes you, I bet you can contribute to so many things. Like you were a great midwife before you retired from the north. I worked in Kedi. That, mommy, use this knowledge to help women, teach them. Honestly, when she was telling me, I was very skeptical. I was scared that, what did I want to say again? We have so many midwives that are even more experienced than me, that are more intelligent than me, that have been doing this thing. But she refused to listen to no. She said that before she would go back, we must start shooting of some of the videos. And that was how I started in March or April. And to God be the glory. Since that time, I've had uh, so many subscribers, even on the other Blue app. I've gotten so many followers, and this one have been monetized, the other ones have been monetized. So I thank God for this, because I didn't even allow that fear to overcome. And I'm still just in that shadow. I don't want to do it. I don't know what to do, because some people doing this live streaming is always a struggle for them, that they don't know what to talk about, they don't know what to say. Please just start something. Everything about our life is a content. Everything. If you have kids, is a content. But then you are going out, you just I'll be going to Balog Market, and you post it. It's content. Nobody will dispute it. It's your page. So far you are not posting things that exposes the body, or any sexual things that that they can ban you in any of this app. Please don't do that. But what you are doing, that this is good and people will benefit from it, go ahead and do it. There's no problem. So those are the causes of prolonged labor. So, and the midwife duty during this time is for her to watch your labor progresses. As a midwife, my work is for me to check the duration of your contraction, your uterine contraction, the frequency, the intensity. I have to check you after 4 hours. I also put on my glove and check your uh cervix to know how dilating you are. Then, how dilated your cervix has gone, or how far, or how many centimeter. Then I have to check your BP. It's very important. Your blood pressure, I have to check it. Your respiration, your pulse, all these things. Then the fetal heart also, have to monitor it to see that it's still between normal. The other day I said the normal fetal heart rate is between 110 to 160 beats per minute. So if it's faster or it's lower, it may mean the baby is in distress. So any action that need to be taken, I have to put it in writing and tell doctor that this lady in labor, the baby is already in distress. And that's why you see when some women deliver, you see the baby is already asphyxiated. That is the oxygen, the baby has oxygen depletion because of the prolonged labor. And if this if intervention is not done in time, it could affect it could cause permanent brain damage, because the brain needs oxygen supply every second. So if it's reduced or there's any discommunication, honestly, it's not the right thing. So this is an emergency in the hospital, and we don't take it lightly. So as your midwife, I have to monitor you. I have to give you medication to even, to strengthen your contraction. We have oxytocin injection. We can put it inside a dextrose in water for the contraction to augment your labor. And most time this works in prolonged labor. When they put that oxytocin into that drip, and maybe it's 15 drops per minute, we calculate it and it's dropping, you will see that the contraction will start, it will improve more than the previous one. And that can also help you to deliver your baby. But everything need to be well monitored. Then we also, as your midwife, I have to encourage you to relax and do some breathing exercise. Even maybe maybe the dilatation is about 4 to 5 or 6, I can still ask you to walk around the hospital, because sometimes this can also help in changing the position of the baby. And I can also tell you to do some light exercises and breathing exercise, because if you have used all your power that you use, to push in the second stage of labor, you may be tired. So we have to tell you that please relax and take it easy. Everything will be fine, mama, don't worry. As a midwife, you need to be very kind, you need to be very sweet. Yes, before they used to abuse us, that hey, we say, was I there when you were doing this thing? Nobody will do it now, because most midwife now, they are professionals. People have learned a lot of lessons from that. And as a human being, it's not even good for you to say that to any woman in labor. So things have really changed. So she has to uh encourage you to stay calm. Then to you as a mother, have to tell you, stay calm and trust your body. Mama, don't worry, I'm here with you, I'm checking you, I'm doing this, I'm doing that, so that my clients will calm down. And just like I said, she can walk, she can change position gently and focus on her breathing. And sometimes your baby might just need a little more time, and that's okay. Just like my mom will say that girls labor is always very painful and prolonged, because she will go and pick her earring, she will do this, she will do that, because they know that we women will love fashion. So baby girls labor is always prolonged. That's how they used to say it. So there's no any cause for alarm that your labor is a bit longer. Please calm down, everything will be fine. God is in control, everything will be fine. Breathe in, take a deep breath, and when you do that, every anxiety will just fly away. Then, just like I said, I, as your midwife, I am here to walk you through every step of the way. That's my duty. That's why I've been paid. And it's not about the money, because I enjoy doing this work. So I'm always around. Hello, mama. How are you doing? You will see, even now, some of these, our new generation midwife, you will see them playing music, be dancing during labor, just to encourage the woman. It's not that she's not feeling that pain. She's feeling it, but just to take her mind, it's a form of diversional therapy for her mind to be off that pain. And you will see sometimes it works well, it works well. And you will see her, before you know it, the woman will just ah deliver. Then remember, a long labor doesn't mean a bad outcome. Every bad story is different, and yours will still be beautiful. So don't bother yourself, don't say but that's my neighbor, when she came to deliver, she didn't stay long like this. Why is my own different? I always tell you that don't ever compare your life with any other person. Don't compare your pregnancy with any other person. Your life is different, your body is different, the way we react to things is always different. So take it easy, everything will be fine. Just take a deep breath, like I told you. That's why you see some women in labor, you see the way they breathe, so that that's a breathing exercise. Every tension, every stress is being released, and you will feel better. Calm down, everything will be fine. You will soon see your beautiful baby girl. So just like I told you that in primary, active labor start from it takes from 12 to 18 hours averagely, while a woman that has given birth before is from 8 to 6 to 8 hours. And during this prolonged labor, there's one thing we do in the labor room, but with your permission, we'll ask the woman that if I help you to rub your nipple, it may help in the secretion of oxytocin. Oxytocin is an hormone that helps in uterine contraction. So we just you know tell you that you should rub it, or if the husband is around, we can tell him to do that. It's just a form of therapy also, to help in increasing the supply of oxytocin, to help in contraction, so that everything will go smoothly. And this prolonged labor, if it's well managed, everything will come into a celebration. But sometimes it can lead to obstructed labor, that is labor dystocia. And also we have what we call cervical dystocia. It can also cause this prolonged labor or obstructed labor, because when there's a cervical dystocia, you are having contraction, but your cervix is not dilating. You are having intense contraction. But when we do VE, maybe I did VE 4 hours ago. By now, if I come back after 4 hours, maybe that time I did it, it was 2 or 4 cm. By now, it's supposed to have added, because every hour I believe is 1 centimeter. Supposed to have dilated like 2 centimeter again. But maybe that time I did it was two, and now it's still 2 centimeter. You say, this is not normal. This is supposed to have gone more than that. So your midwife also we know whether this your labor is progressing or not. And if there's reason for emergency CS, your midwife will let you know. She will explain to you, and then get your doctor, and they will put it together and see that since she came 8 a.m. on the 10th of October 2025. So you start counting for hours. This cervical dilatation is still 2 centimeter, and she's having contraction. No, that's not normal. That's not normal. That's abnormal labor. So if there's any reason to do any emergency intervention, it will be done. But no matter what we want to do in the hospital, we always take you along, involve you, give you informed information, so that you will know what we are saying. This is madam, we did VE, but we would say it in a way that you will not be too anxious, you will not be too scared of what we are telling you about, or what the outcome will be. So, I was explaining something when I started, that we have 5 P's in prolonged labor, and I said powers. If that powers is not is inadequate, that is the power that is contracting, that is the power that is controlling their uterus, that is the uterine contraction. If is poor, this is due to poor uncoordinated uterine contraction, is a major cause of prolonged labor. Because when there is contraction and there's no problem in the cervix, as we are contracting, the baby is in the uterus, contracting mean like this. That's when the woman will be feeling extreme pain. As she's contracting, the cervix will be dilating accordingly. But if you are not having enough contraction, maybe sometimes the way we calculate it, sometimes we say every 10 minutes she's having a contraction. That is frequent. But maybe you have contraction till the next 30 minutes again. No, that's why we say we want to augment this labor, by using oxytocin drip to help you to have contraction, so that you can have your baby. And if this prolonged labor leads to obstructed uh labor, that is obstetric emergency, because some people can be in labor up to 24 hours. No, emergency CS need to be done to save the life of the baby and the mother, because the baby may be severely asphyxiated, and this could lead to the death of the baby while still in the uterus. So there's increased risk of fetal death, that's stillbirth. Then the mother in obstructed labor, because of the head of the baby that has been on the perineum for a very long time, may cause problem that we call vesicle vaginal fistula. The woman later, maybe after delivery or after CS, she may be leaking urine. It's very common. When I was working, I was schooling in Sokoto then, because some of them they married very early, and most time we have these cases of vesicle vaginal fistula that they have to, after delivery, after 6 weeks, you need to go to, there's one hospital in Sokoto that is where they do their surgery. That time is one white man, one doctor that used to come from abroad to come and do it for them. And you see that some of them, the husband will even divorce them when they are still there, because she's leaking urine, so she's no more useful for him. So just like I said, prolonged labor can lead to oxygen deprivation at birth, and this can cause asphyxias in baby. The brain is deficient of oxygen, and this could lead to permanent brain damage. That's why you see when they deliver some children, you will see that the way you say what do they call them? The baby shall have some brain damage because of during delivery. That's why, as a midwife, we are taking care of a woman in labor. We are always very careful. We will make sure that we supervise everything very well, so that complication will not come uh and happen. Then you too, when maybe when that baby uh is grown up, you not be happy. Honestly, you not be happy. Prolonged labor, sorry. So that is it about prolonged labor. So what is the difference between obstructed labor and prolonged labor? When the active phase of labor is longer than 12 hours, the main causes of obstructed labor include a large or abnormally positioned baby, a small pelvis, and the problems with the birth scanner. I talked about CPD, cephalopelvic disproportion. Even our mom that time, if you are pregnant, say, don't take Bonvita oh, don't eat too much oh, so that when you want to deliver, your baby will not be too big. That they may be right to some extent, because if the baby is bigger than the pelvis, honestly, most time, because if you see that in the hospital they do CS, there must be indication for it. No doctor will just see you and say, you have to go for CS. No, there must be an indication for that. And this CPD is one of the reason why they do this CS, especially some ladies that are very short. Their pelvic will be very small, and if the baby is big, there's no way the baby can pass through. That's what we call CPD, cephalopelvic disproportion. Cepha is the head, pelvic is the pelvis, then disproportion, that means the baby can't pass through it. That birth canal is small. So what you see, some women, they did all their children, they had all their children through cesarean section, and most of them, be looking at them, you look at their height, you will see that it's the pelvis that has problem. You see their shoe size very small, 36, 38. You will see that they are very small, so most time it results into cesarean section. So how does prolonged labor cause birth injuries? Prolonged labor, just like I said, can lead to oxygen deprivation or birth asphyxia in babies. Essentially, the baby's brain is deprived of oxygen and adequate blood supply, which starts a cycle of injury that can cause permanent brain damage. At least mild asphyxia can be managed easily. Even me, when I was working, I've had calls to resuscitate asphyxiated baby. We suck out the mucus from the mouth, from the nose. Sometimes we give mouth to mouth respiration, and you will see we do cardiac massage. There's a way we do for baby. We just use either one or two fingers. We just we do it. Do mouth to mouth respiration by putting gauze on the baby's mouth. Then you too, you apply your mouth, and most time you see the baby, the color will change back, because when the baby is asphyxiated, the baby will turn blue. And that's when you score your APGAR score, you see that 00002, so you know that the baby is asphyxiated. You even see the color changing to blue. So if you act fast, you do what you are supposed to do, remove all the mucus that is blocking the airways, you see, wrap the baby very well, and you see the baby will come back, the color will turn pink, and the baby will be fine. Please like this my live stream. Thank you, thank you, thank you. Just like as you are coming in, like it more. Thank you. God bless you as you do so. So that is it. So what can you do to avoid prolonged labor? Management and treatment. I think I've said it. If you are in prolonged labor during the first stage, the goal is to encourage stronger contraction to help dilate your cervix. Your healthcare provider may recommend nipple massage if appropriate to help your body naturally to release more oxytocin, which encourages stronger contractions. Anything we want to do for clients, we need to take permission. You don't just these days we have we call them May midwife or middleman. We have nurses now, male nurses that do midwifery, and they can conduct because they did midwifery. So you can't say because you are a middleman now and a woman is in labor, you want to encourage the oxytocin to be released. You just say, hey, madam, remove your cloth, and you start, they will sue you for sexual abuse. But as a woman, as a midwife, you can explain to her that, let me help you to just, maybe let's rub this your or nipple. It will help you to do so. Anything you want to do for your client, please explain to them very well. Explain to It's very important so that you won't be in trouble, because things are changing now. In the hospital, you see asthmatic patient, diabetic patient, hypertensive patient, kidney patients. Hey, they know so many, some of them, they have read a lot about their condition, that as you are talking, they know. So if you are taking care of them and you are not doing the right thing, it's even better in Nigeria. But when you are working abroad, you have to be very careful, because these patients, they are very intelligent. They know so many things. They read, they jot, and if they see that you are not doing the right thing, they can report you. So many nurses have lost their job because of that. So, and as a nurse or midwife, whatever you are doing, you do for your patient in labor, you have to make sure that you write everything down. Is very, very important. There's what we call reports. I know that in some most advanced country now, they don't write, they use a system. But when I was working, we use our biro, we have our report book like this, very big. Before you close, everything that you did for your patients during your shift, you have to write everything down, so that the next person coming after you to the shift will know that this is what you have done for your clients. And you have to make sure everything is right, the temperature, the BPO, because you have already written it down. If there's any shift, if there's any, maybe everything, any something is increasing or is going down, the new person on duty will know, and she will be at alert, either to call the doctor or to administer drugs to help the client. But if you did not write it down, how will she continue? It's for the continuation of the management of patient. I think that time we used to use a pathograph in the labor room, just to monitor the progress of the labor. Everything, the contraction, the intensity, the duration, the fetal heart, you have to monitor, you have to be writing everything. In advanced country, they have what we call sonic head in the labor room. You will see that they will put something like a belt on the woman's tummy. That is to monitor the fetal heart. So if there's any changes, maybe the fetus is going into distress, the next thing is for them to do CS, except if the patient is already on induction, on a oxytocin drip, and she's almost fully dilated, then they can hasten that, then the client will deliver. So whatever you do for your client, you have to write it down. That not writing down has put a lot of nurses and midwives in problem. So whatever you do for your clients, you have to make sure you document it. It's very important. Nursing and midwifery medicine is about documentation, because if anything you document will save you. When the client says that you didn't do it, or your matron say that you didn't do this, you say, I did it, ma, this is it, you are covered. So whatever happens, they will know that it's not because you did not attend to your clients that that thing happened. So somebody is asking me that, can prolonged labor cause fetal distress? Prolonged labor may increase the risk of maternal and neonatal infection. It may cause fetal distress. It may cause neonatal hypoxia, uterine rupture, and postpartum hemorrhage. Because uterine rupture is, the uterus can tear. It can tear because she's contracting and she knows she's not dilating. Maybe she has cervical dystocia and this baby wants to come out. She's dilating. She knows she's contracting. She's contracting. She's contracting. The clients can have uterine rupture, and as that uterus is contracting and maybe she's not dilating accordingly, The baby, the baby is in the uterus. The baby can have hypoxia. The baby can have uh fetal distress. And after delivery, the woman can also have postpartum hemorrhage. So I do tell people when I was working there that it's always because most of them they live in the rural area. We used to tell them that as soon as you 30 something weeks and you know that maybe or you start feeling any sign like this or maybe show or whatever, please start coming to the hospital because in rural area over there, especially during rainy season, it's always difficult for them to get to the hospital. It's not everybody that lives in the city. So if you come to the hospital, you'll be attended to and complication will be minimal. But when you stay at home, look, I've seen cases in the north that sometimes when I tell people, you will think, this woman can lie. Things that you never expected that you will see in midwifery. When I was working there, there's nothing I've never seen in my life. I've seen a case of breach, footling breach. The whole body was out, the head was still inside her uterus. I've seen that the baby was already dead. The color has changed to blue. In fact, there's what we call macerated baby, that the body of the baby was already peeling. Ah, no, 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 no. That place is the home of pathology. You will see things that even you'll be shocked that wow. Hmm. May God help us. People are going through a lot. And it's because they are staying in the village. Sometimes they even want to come, but they will not get vehicle to bring them back, to bring them to the hospital in time. And the client will be going through so many things. So even if you're in the city and you are having contraction, you see that though most people now I don't think there are people that still deliver at home, but some of them still deliver at home. In fact, one guy told me that his neighbor, since they've been living together, she has never delivered in the hospital, that she will just go to the toilet and just on the floor there she will deliver her thing, except if they have some issues they will come. But things are changing, everybody is getting wiser. you know then it may also be a marker for increased risk of maternal pelvic floor and genital trauma during delivery, with a subsequent risk for future incontinence, just like I said, that VVF, vesico vaginal fistula, when the urethra is already bruised, and because of the baby's head that has been there for a very long time, this could lead her to be leaking urine. So somebody asked me that how long does it take to dilate from 1 to 10? Anyways, in early labor, dilating from 0 to 6 centimeters can take from a few hours up to 12 hours, though for some people up to 20 hours. During active labor, dilating from 6 to 10 centimeters generally takes around 4 to 8 hours on average. You may dilate about 1 centimeter an hour. If you want to do vaginal examination, when we wear this hand, when we wear our gloves, and if you want to do VE, we start with these two fingers, because normally this one finger like this, if it enters and you can sweep it around like this, that's 2 centimeter. This one 4 centimeter, 6 centimeter, 8 centimeter, this 10 centimeter. So by the time it gets to 10 centimeter, let's say this is the baby's head. Let me use this my hand. Let's say this is the cervix now. This my hand is the cervix, and you are now seeing the baby's head like this, naked like this. That means the cervix is fully dilated and the baby is ready to come out. But when it's something like this, maybe it's about 4 cm, 4 cm, 4 cm, 6, 8, then 10. You see that the baby is ready to come out. It's good to know all these things. Even if you are not going to do VU by yourself, it's good to know all these things so that when they are talking about it, you know that thank God, everything is going fine. And even if you hear anything that you think may scare you, please calm down. Your midwife, by now you should be familiar with her. Calm down and you are free to ask her questions. And if there's any change in the birth plan, she will also tell you and your husband that this is what we think may benefit you for the safety of the baby and the mom. Because we don't do anything in the hospital without involving the client involved. We need to explain things to you, that this is what we feel will be better as this labor is going, is getting prolonged, and we don't want this baby to get asphyxia. We don't want the woman to develop complication. Just with good explanation, you will see that they will understand and they will agree. It's before that people used to be scared of a cesarean section. Anything that will bring relief, that you will see your baby, is not uh is not a bad thing. Hmm. I heard of a story that there was a longest labor ever recorded, that it took 75 days. I don't know how far it's true. They said that the name of the lady was Joanna, not in Nigeria, or please, not in Nigeria. I think it's over there abroad. Joanna was forced to remain in the tilted position 24 hours a day for 2.5 months. Jesus. After 75 days, and what is believed to be the longest labor ever recorded, Joanna gave birth to a healthy girl, Iga, and boy, Ignacy. The two babies were delivered by cesarean at a neonatal clinic in Wrocław, Poland. 75 days. Maybe, there's what we call forced labor. Forced labor, the client may be feeling as if she's in labor, but it's just like Braxton Hicks contraction, just tiny, tiny contraction, and there's no dilatation of the cervix. Because if she was having serious uterine contraction for 75 days, those baby will not survive, no matter what. They can't survive. Even the woman would have developed so many complications. Who does that? By 24 hours sef, even me, when I had my daughter, I had prolonged labor because I started labor on Friday morning. Though it wasn't strong like that, maybe just like to off and on contraction. Throughout Saturday, I was in the hospital. So that Saturday evening, the doctor is late now. Dr. Samaila now said that if I did not deliver that Saturday night, that they would just prepare me for cesarean section Sunday morning. So when they left in the night now, around that time, my membrane was still inside. I had not ruptured membrane. But around 1 a.m., I think, my membrane just ruptured. Wow. So my friend that conducted me said, thank God, Eunice, you have ruptured your membrane. So by 1 to 2, I had my baby girl. So all the pain. And the funniest thing, as soon as that baby comes out like this, we just forget about the pains that you have gone through, the intense pain. God will put an end, you will just forget about it, you know. Then somebody is asking me again, can resting be too much during can resting too much delay labor? Can bed rest delay labor and delivery? No. Bed rest used to be tried on a regular basis to delay labor that had started early. Yes, if it's preterm labor, they can give us some. I think I talked about, what was it, 2 days ago? I talked about premature rupture of membrane. That if the membrane rupture before 37 weeks, they can give her some antibiotics and some corticosteroids for her to rest so that the pregnancy can continue. So bed rest can also be initiated, and this is to prevent the baby from being born too soon, called premature birth. But bed rest during pregnancy is no longer routinely recommended. Normally it's good for everybody to be up and doing, not that every time. Last week I didn't go out, my mood was terrible for no reason. So I now discovered that sleeping at home will not help me. Though I'm not working again, but I do business. I said, so this way, I said, this Monday I have to go out, and because if you go out, you feel happy, you see people, you talk to people, and whatever you may be bothering you will disappear. So it's not good to always stay indoor, and I'm not saying you should be walking about as if you don't have any work, but it's good to mix with people, that even people that are depressed, it's good. We always tell them that they should maybe watch TV, as watching TV will be a sort of, we call it diversional therapy. It helps, in their treatments. So all these things matters. Or you are sick, you are always lying down. Take a walk. That walk that you take will also help you. So resting too much cannot delay labor, but when you are pregnant, it doesn't stop you from moving about. Or even when labor starts and it's not yet well established, you can take a walk around your environment, or your estate. Just walk around. This will also help your baby's descent to come down very well, come back, take a warm bath, and then wear a very nice cotton nightwear. So you don't have to be lazy because you are pregnant. Pregnancy is not a disease, it's a gift from God. So many women are praying to God to get pregnant. So you should not be lazy. In fact, some people, when it's almost their EGD, they do a lot of exercise, walk, that it will help. And sometimes it do help. It can help. You don't have to. It's only during the first trimester that maybe a woman is always sick, that she can be doing lazy, lazy. But after that first trimester, you see some of them, they are very strong. They can go anywhere. They can, in fact, they can climb mountain with that big tummy. So just make sure you are always active, and this may also help you during labor pains. Then somebody was asking me, what is the average labor time for a first baby? The average labor starts from 12 to 24 hours, I said it, for a first birth, and is typically shorter for a subsequent birth. I said from 6 to 8 or at most 10 hours for a woman that has given birth before. But for a primate, a new mom that is just giving birth to her first child, may take like 16 to 18 hours, even up to 20 hours before she delivers. Depends on how fast she dilates and how contraction comes. So what is another name for prolonged labor? Just like I said, we can also call it labor dystocia, complication in nulliparous women that may disrupt the process of vaginal delivery, making it a major indication for instrumental deliveries or cesarean section. Before, there's what we call fetal no, instrument delivery. They use it. There's one instrument like that they can, it's curved like this. They'll put one here, one here. They will use it to bring the baby's head out. But they discover that it's causing some injuries, can cause some injuries to the baby, so they stop it. They rather do cesarean section. Either they augment you by using oxytocin drip to help your contraction. Then if that one does not work, Grace, I can see you. Oh yeah, oko bá àǹtí ẹ̀ láìkí ẹ̀. Àbí Grace mi kọ́ lè, Grace Contabura. Àbí it's another person. Tap on the screen and like my live streaming. So that's a labor dystocia. So when there's labor dystocia, prolonged labor is an indication for either cesarean section or for instrumental deliveries. But instrumental delivery is no more in use now. I think it was before, for a very long time. So how do you know that your baby is in distress in your womb? There are some signs that you will know during third trimester. You see that you have gained more weight, then maybe slight vaginal bleeding. Then the client can report that there's decreased fetal movement. When the baby is moving less or not at all, please ask your doctor to measure quick hands, or you go and do scan. And I used to say it every time that, thank you for the light, God bless you. And I used to say that as a woman, you should always listen to your body. You know how often your baby kick, and now you are not feeling it and you are keeping quiet. Don't keep quiet, please. Go to the hospital and say, I'm not feeling my baby the way I used to feel it. Oh, please, can you help me check? Nobody will say you are coming to hospital too much. It's your right to know everything about your baby. When you do scan, ask your doctor, ask your midwife, ask them questions. We are talking about a whole baby. For 9 months, you've been carrying this baby around. You've bought so many beautiful things for you to welcome your baby, and now you are not feeling the baby the way you're supposed to feel it, and you are keeping quiet. No, 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 please. Don't do that. Or you are having abdominal pain during pregnancy, either severe or not severe. Please don't do self-medication. Go and see your midwife. Your midwife is your friend. Her number should always be with you, and tell her you are coming to the hospital. Or if there is preterm contraction or cramps, if there's going to be a premature labor. The other 2 days ago, I talked about premature rupture of membranes, where the woman will be seeing water, not urine. No, she will be seeing water coming out of her VJ, and she's having abdominal cramps, and it's not yet time. Please pack yourself and go to the hospital. Or abnormal fetal rate. If the baby is not moving well, then something is wrong. When you get to hospital, they will discover whatever it is that is wrong with that baby. It's better for you to go to the hospital. So you see, this prolonged labor can also cause cerebral palsy. Yes, because of that depletion of oxygen supply to the brain. The brain need constant oxygen supply, so you don't have to take chance honestly. So I think these are all the things I have for prolonged labor. Thank you for the like. Oh, you that have you have liked, please, everyone that is here, like it more. Hmm? Thank you for coming. God bless you. Like it more, like it more, like it more. It helps. Vivi, you joined. Even if you are just passing by, this is talking about life. This is talking about pregnancy. Just give a like. Hmm? I know some people like where they will be talking all this thing. I am talking about life here. And everyone pray to get pregnant. Everyone pray to have a child. That's what I do here. I am the fashionable midwife. I am an experienced midwife. I talk about pregnancy, babies, and so many things that concerns a woman. Talk about widowhood, talk about relationship once in a while, or general gisting. So when you come, even if you are not staying, just say, ah, this woman is doing, even if you just like my glasses on my face, just give me a like. Mm? Thank you, thank you, thank you. Vivi, Pendragon, Biba, thank you. Thank you for the like. God bless you. So if you have questions, you can drop it. Mhm, mhm. No music and I'm dancing. Ah, thank you for coming. Appreciate you guys. Thank you for the likes. Thank you for all you have done. If you have any question, please can you let me know. Tabitha Ezinwa Olutop Access Benny Odunayomi. Please like it. I will soon be leaving. Thank you. Thank you, thank you, thank you, thank you. It's almost time. Hope you enjoyed it. Ẹ̀yin tèmi báwo ni ò ṣe wà o. La 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 the other day I had over 1 point something likes. So thank you for coming. I'll see you tomorrow by God's grace. Good night and enjoy your night. Bye.